During the second wave, news of a possible COVID's third wave is circulating rapidly. The prediction of the third wave impacting children the most is raising eyebrows. On 1st June 2021, Center said a national expert group has been devised to review COVID-19 infections in children. In this video, we will have a look at what the Center, Member of Health in Niti, Aayog and AIIMS Director have to say on this. So let's get started. Noting that the prevalence of COVID-19 infection in the pediatric population may surge following the change in viral behavior, the Center asserted that there will be no deficiency in the care and infrastructure requirement for children who may get infected. Addressing a press conference on the COVID-19 situation in India, Member of Health in Niti Aayog, Dr. V.K. Paul said that the guidelines for dealing with COVID-19 in children will be released soon. He said that COVID-19 infection in the pediatric population is generally asymptomatic and rarely requires hospitalization. Dr. V.K. Paul also informed that a multi-system inflammatory syndrome, which is a rare complication, has been detected in some children recovered from COVID-19. Some of the symptoms found in children with this syndrome are fever, body rash, inflammation of eyes or conjunctivitis, breathing troubles, diarrhea and vomiting. Guidelines are being formulated to treat this unique disease found in some children. Now let's look at what AIIMS Director Dr. Randeep Guleria has said on it. He cleared the air about the possible third wave of COVID-19 to impact the children most and said that there is not enough evidence that can prove this theory. Illustrating the reason behind children showing fewer cases of infection, he said, the ACE receptors to which the virus binds itself to the human cells are relatively less in children as compared to adults. Earlier, the Drug Controller General of India had also approved for phase 2 and 3 clinical trial of Bharat Biotech's co-vaccine on those aged between 2 to 18 years. Health Ministry in their guidelines earlier suggested the use of methylprednisolone and antimicrobial medicines for the treatment of multi-system inflammatory syndrome in children with cardiac dysfunction, shock, coronary involvement, multi-organ dysfunction. The guidelines also suggested the use of intravenous immunoglobulin therapy for the treatment of the rare syndrome. It also said that steroids or IVIG may be used in absence of any existing medical condition. Now, let's have a look at countries that have approved or are considering vaccinating children against COVID-19. On 31st May, Italy approved the use of Pfizer Biotech vaccine to 12 to 15-year-olds. On 1st June 2021, Singapore opened up its COVID-19 vaccination program to adolescents. On May 28, European Union's health agency authorized the use of COVID-19 vaccine from Pfizer inclusive to Biotech for children aged between 12 to 15 years old. Along with this, Germany is planning to offer the first shot to children aged between 12 to 16 from 7 June 2021. In this video, we covered the biggest question of these days, how prepared we are to fight the predicted third wave. With this, we come to the end of this video. Thanks for watching. Take care and make sure to get yourself vaccinated.